Hello everyone, my name is Amanda Casper. I am a graduate student at Eastern Illinois University, and this is my oral abstract for my systematic review. The research question that I chose to look into is, what impact does maternal diet throughout pregnancy have on the influence over the prevalence of food allergies in children? A little bit of background on my topic choice. There's been an increase in food allergy prevalence among children. According to the Centers for Disease Control and Prevention, the prevalence of food allergies among children increased 18% from 1997 to 2007. From 2004 to 2006, there were approximately 9,500 hospital discharges per year relating to food allergies in children under the age of 18. Additionally, allergic rhinitis and asthma have been closely linked to food allergies in children. Previously, it used to be recommended that pregnant women avoid peanuts to prevent peanut allergies. In 2009, a policy paper from the American Academy of Pediatrics was published to reverse that policy, stating that there was little to no connection between maternal consumption of peanuts and childhood peanut allergies. The reason I chose this topic was due to the increase in food allergies in children. I've noticed a rising trend in peanut-free classrooms and even peanut-free schools since there are so many children with food allergies. Since I plan to work within a school district system, I chose to study childhood food allergies. The purpose of this study is to determine whether maternal diet throughout pregnancy has any influence on the prevalence of food allergies in children. An overview of my systematic review. I used 3 databases to find my sources. I used CINAHL, the EIU Booth Library System, and PubMed. I found a total of 6,857 articles during the search, and 10 peer-reviewed articles that I found met the criteria. My inclusion criteria included they had to be peer-reviewed, the articles had to be published between January 2009 and November 2019, they had to be written in English, the studies had to give pregnant women a food frequency questionnaire during pregnancy or shortly after birth to prevent biases. Allergens in children were determined by skin prick test and diagnosis. For the 2 animal studies I found, my inclusion criteria was that female mice were exposed to peanuts prior to conception and that peanut was added to their food throughout pregnancy for the experimental group. The conclusion that I found was that overall, increased exposure to peanuts while pregnant may lead to a decreased risk of peanut sensitization or peanut allergies in children. Fish and other fatty acid-containing foods may decrease the risk of asthma and allergic rhinitis in children, which may be symptomatic of future food allergies. Maternal peanut allergies in mice seem to determine that the offspring would also have a peanut allergy. More research is needed to determine whether these conclusions stand true for other food allergies as well, such as milk or dairy, or eggs. Limitations of some of the studies were that the women had to recall food frequency after birth, which could lead to bias. Peanut allergens were not established in children. The likelihood of a child getting a peanut allergy was based on their IgE serum levels. And lastly, the trimester or weeks into gestation were inconsistent between studies. The rise in food allergens from 1997 to 2007 corresponds to recommendations of maternal avoidance of peanuts during pregnancy and lactation. Future research could determine if this was a direct correlation. These are the two references used for my background information. Thank you everyone for watching my oral abstract.